The U.S. healthcare system sucks. A rant by Bobby. First of all, I'm sure many of you are saying, yeah, no shit. But I just have had experiences in the last few days, and I wanted to come here and rant about them. One is just insurance nightmare with my biologic for my psoriatic arthritis. I have had to have multiple prior auths for one prescription. And had the pharmacy actually cancel part of the prescription. And then that was why I required another prior auth. And when I called to find out why, they said the notes in the computer were that I had not returned a phone call. I informed the girl that I was speaking to at the moment that I am disabled and my phone is never like more than arm's reach away from me because I have so many healthcare issues and so many providers and specialists, and I know I have to answer that phone if it rings. So she apologized and supposedly fixed it, that's the last dose of my Cosentyx for the loading dose of 5 injections. That's supposed to be done on Sunday. I have yet to find out what. Ooh, that is from. That's an owie from my bonnet where I tied it on my. I'm so sensitive. That looks like, yeah, okay. I'm growing a horn. Anyway, ooh, squirrel. Yeah, so hopefully it's supposed to get here. My rheumatologist told me that it was okay if I was up to a week late. Otherwise, I have to start the 5 injections all over again. My biggest rant, and if you've stayed until this point, this is the meat of the situation, is that if you've seen my past videos, you know that I finally found a doctor at a pain clinic that listened and cared. So she prescribed some medication for me. And it is of the O variety. I won't say it here on TikTok because evidently that's a bad thing we're not supposed to talk about. So y'all know, if you're a pain patient, you know what I'm talking about. So I've had this medication in the past several times, no problem. I picked up my prescription, the first one from my normal pharmacy. Now, I don't know if some of you know, if you are in the chronic illness community, you do, because it's affected you, that there was a hack, I think it's a ransomware thing, of a company that handles the majority of the communication between doctors and hospitals and insurance companies and pharmacies. And so people aren't able to get their medications by electronic. If a doctor transmits it electronically to the pharmacy, it's not going through. The insurance companies aren't able to get it to approve it. It's a nightmare. So, obviously the roundabout with that would be faxing. Okay, well, that's not an option for controlled substances. So the third option would be handwritten, but my pain clinic doesn't do handwritten prescriptions. It is 2024, but my personal feelings are they should have a backup plan, but that's neither here nor there. Anyway, they don't do it. So my doctor told me that Walgreens was one of the pharmacies that was not affected and that they were able to get their prescriptions through to Walgreens. So that is where she sent my prescription. Now, it has to be special ordered from a certain manufacturer because of my MCAS issues that I was having. Again, if you've been watching my videos, you know, it was causing mast cell, and we think it might possibly be a filler that this certain manufacturer is using, but hopefully this other one doesn't. And so I called about an hour after my doctor's appointment to Walgreens to ask them when they thought it would be ready because I knew that with it being a special order, I didn't know how long it would take. I was met with rude people. There was an issue. I finally got through to the pharmacist, and I was told that this medication requires a prior authorization. And I was like, okay, but now I'm confused because I've never needed a prior authorization for this medication before. And when I had the medication billed at Save On, it didn't require prior authorization. So I asked that question Kind of seems like a logical question, right? No, no. The pharmacist was very angry with me and told me that this was my issue. Basically, that I needed to figure it out. That it's not us, it's your insurance company. And that's something you'll have to handle. Okay. Got off the phone, called Savon to see if possibly this thing had been rectified between the time that I had my doctor's appointment and now. And was told no, that I would have to have a written prescription. So now I'm waiting to hear from my doctor about this prior authorization, and now I'm understanding the people that are in the chronic pain circles that are talking about not being able to get their medications for one reason or another. This medication, the dose that she was giving me was kind of sort of taking the edge off, not a lot. But the biggest thing it was doing was helping me sleep, which was fabulous. So it's no skin off my nose to wait, and to get it figured out. But I do understand for those people who have been on their medication for a while or who are in like severe debilitating pain, even just lying in their bed, this situation is ridiculous. Between our healthcare system and the DEA sticking their nose into our healthcare. Yeah. Rant over.